Hey, Russell here from Adelaide West Physio and Pilates. Slightly controversial topic here. What do we think as a group of electrotherapy? And the short answer is, so when I went through uni, we learned about electrotherapy to the nth degree. We learned about ultrasound, how to do the testing and heat cold testing, and we learned about medium frequency and interferential and shortwave diathermy. But the thing is that as time's gone on, it's been shown to be more and more useless, really, in terms of managing conditions. Do we have any electrotherapy here? We do, actually. We've got one ultrasound machine, one therapeutic ultrasound machine, and that only gets used for helping mastitis. That's the only condition that it's been shown to have a good effect. There's good evidence behind using ultrasound at high doses for mastitis, but that's about all. So we don't use it for sprained ankles, we don't use it for low back pain, we don't use it for all these things where it's been shown to be completely a waste of time. Which goes against the grain for a lot of old school physios, and I probably put myself in that category in terms of how long ago I graduated. But it's really frightening to know that there are still practitioners out there, physios and other professionals that rely really heavily on electrotherapy, and there's no evidence for it, and it's frightening. And we feel really strongly about it. We and part of it's because our philosophy is to do with active management. We want people to be taking control of their problem. We want people to learn things they can do to help their problem. We want them to be less reliant on us as physios. We want them to have skills. So putting someone on a machine for 20 minutes and giving them a bell that they can tinkle if they run into any strife isn't really achieving any of those things. And that's the very definition of passive therapy. So passive therapy is when something's done to you, and active therapy is when you do something to help yourself. Passive therapy really doesn't help anyone to achieve those goals that I just mentioned. It doesn't help you to learn anything about your problem or to learn how to manage it yourself. It means you're reliant on coming somewhere and having something put on you and then lying back and reading a magazine. My first job involved a lot of that, and mind you, it was 1995. That's a little while ago now, I suppose, but laser, that's the other one. We had laser, we had ultrasound, we had interferential. We didn't have shortwave diathermy, which is a scary looking machine if ever you've been on one. It's nice and warm, like it's good warmth, no doubt about it, but in terms of actually effectiveness of what you're going to feel like the next day or the next couple of days, it really doesn't add anything. So it's no better than hopping under a hot shower or having a warm bath. Yeah. So that's my beef about electrotherapy. We wasted a lot of time at uni learning about it, but then again, back then it was a different situation. It's not defendable now. There's no reason why your physio should be relying on electrotherapy to help you get better. And the series of articles from the Lancet from 2018 on managing low back pain was really explicit about that, about the low value therapies. There's no place for low value therapy, and electrotherapy is most definitely one of them. And this is going to be a controversial thing to say. I wonder if dry needling kind of fits a little bit into that slot as well. Yes, it's pain modifying. Does it have a long-term effect? And more than that, it's very passive therapy, isn't it? You know, you're lying there while someone's putting needles in you, so it's not really helping you help yourself at all, unless you're going to start needling yourself. And I worry a little bit that it might turn into a situation where physios put needles into people and then leave the room, like electrotherapy used to be. And I think that would be a sad day for the profession if that's what ended up evolving or devolving, as the case may be. So anyway, slightly controversial. That's my 2 cents worth. I'd be interested in your comments. I don't mind people that disagree with me on this. If you want to slam me, that's okay. But as a group here, we feel very strongly about the role of, or the lack of a role of electrotherapy. And as such, our electrotherapy books are holding up the monitors at the front desk at the moment while we are waiting to get some decent monitor stands. And so at least they're doing something useful. Cheers. Hey, thanks for watching our video. If you liked it, we would love it if you would hit the thumbs up button below. It lets YouTube know that we know what we're talking about and that we're helping people. If you like the style of our videos and you'd like to see more of them and know when a new one is published, then just hit the subscribe button. If you've got any thoughts or comments or questions, please add them below, because we answer all of them, and we love to hear comments because it helps us to shape the channel and find out what people want to know. It helps it to become as relevant as possible for everyone. So thank you.